Welcome to today's lecture on neurology. Today, we will be delving into the fascinating and intricate realm of anxiety disorders and their neuroscientific underpinnings. Anxiety disorders affect millions of individuals worldwide and have a significant impact on their daily lives. Understanding the complex neurobiology behind these disorders is crucial for effective diagnosis and treatment. In this lecture, we will explore various topics, including neuroimaging findings in anxiety disorders, the role of the endocannabinoid system in anxiety regulation, the impact of childhood trauma on the development of anxiety disorders, genetics and heritability of anxiety disorders, cognitive biases in anxiety disorders and their implications for treatment, the role of neurotransmitters such as GABA and serotonin, neurocognitive deficits in individuals with anxiety disorders, the link between inflammation and anxiety disorders, psychodynamic perspectives on the etiology and treatment, cultural considerations in diagnosis and management, neurofeedback and brain stimulation techniques, and the role of the immune system in anxiety disorders. Neuroimaging techniques such as functional magnetic resonance imaging, fMRI, and positron emission tomography, PET, have provided valuable insights into the neural circuitry underlying anxiety disorders. Studies have shown hyperactivity in the amygdala, a key region involved in fear and emotional processing, in individuals with anxiety disorders. Additionally, abnormal activation patterns have been observed in the prefrontal cortex, anterior cingulate cortex, and insula, which play important roles in anxiety regulation and threat evaluation. Such neuroimaging findings not only aid in understanding the neurobiological basis of anxiety disorders but also hold promise for developing more targeted therapies. The endocannabinoid system, consisting of cannabinoid receptors and endogenous ligands, has emerged as a crucial regulator of anxiety. Research suggests that dysregulation within this system can contribute to the development and maintenance of anxiety disorders. Animal studies have demonstrated that activation of cannabinoid receptors can have anxiolytic effects, reducing anxiety-like behaviors. Furthermore, pharmacological modulation of the endocannabinoid system has shown promise in preclinical and early clinical trials as a potential therapeutic approach for anxiety disorders. However, more research is needed to fully understand the complexities of this system and develop safe and effective treatments. Childhood trauma, including abuse, neglect, or exposure to traumatic events, has long been recognized as a significant risk factor for the development of anxiety disorders later in life. Research suggests that traumatic experiences during critical periods of brain development can alter the stress response system and contribute to long-lasting changes in neural circuitry. These alterations can result in heightened sensitivity to stress and impaired regulation of emotions, leading to increased vulnerability to anxiety disorders. Understanding the impact of childhood trauma on the developing brain can inform early interventions and improve outcomes for individuals with anxiety disorders. Genetic factors play a substantial role in the etiology of anxiety disorders. Twin and family studies have consistently demonstrated higher concordance rates for anxiety disorders among monozygotic twins compared to dizygotic twins. Genome-wide association studies have identified several candidate genes involved in anxiety regulation, including those related to neurotransmitter systems, for example, serotonin, GABA, and stress response pathways, for example, HPA axis. However, the genetic architecture of anxiety disorders is complex, involving multiple genes of small effect, gene-environment interactions, and epigenetic modifications. Further research is needed to unravel the intricate interplay between genetic and environmental factors in anxiety susceptibility. Cognitive biases, such as attentional biases toward threat and interpretation biases that amplify threat-related information, play a critical role in the maintenance of anxiety disorders. These biases can perpetuate anxious thoughts, leading to heightened anxiety and impaired daily functioning. Cognitive behavioral therapies, CBT, aim to identify and modify these biases through techniques such as cognitive restructuring and exposure therapy. By challenging negative thoughts and gradually confronting feared stimuli, individuals with anxiety disorders can learn to reframe their thinking patterns and reduce anxiety symptoms. Understanding the cognitive processes underlying anxiety disorders is fundamental for effective therapeutic interventions. Neurotransmitters, chemical messengers in the brain, play a crucial role in anxiety regulation. GABA, the primary inhibitory neurotransmitter, inhibits neuronal activity in key anxiety-related brain regions, providing a calming effect. Serotonin, a monoamine neurotransmitter, is implicated in mood regulation and is involved in anxiety modulation. Dysregulation of these neurotransmitter systems can disrupt the delicate balance between excitatory and inhibitory signals, leading to anxiety disorders. Medications targeting GABA and serotonin systems, such as benzodiazepines and selective serotonin reuptake inhibitors, SSRIs, are commonly used in the treatment of anxiety disorders. Anxiety disorders are associated with a range of neurocognitive deficits that impact various cognitive domains. Studies have consistently demonstrated impairments in attention, working memory, executive functions, and inhibitory control in individuals with anxiety disorders. These deficits can contribute to difficulties in processing and regulating emotions, leading to heightened anxiety and reduced cognitive flexibility. Understanding the neurocognitive profile of anxiety disorders can inform the development of targeted interventions that address both emotional and cognitive aspects of the condition. Growing evidence suggests a bidirectional relationship between inflammation and anxiety disorders. Inflammatory markers, such as cytokines and C-reactive protein, have been found to be elevated in individuals with anxiety disorders, indicating a state of increased systemic inflammation. Conversely, chronic inflammation can contribute to the development and progression of anxiety disorders through its effects on neuroplasticity, neurotransmitter systems, and stress responses. Targeting inflammation through pharmacological and lifestyle interventions could potentially serve as a novel approach for the management of anxiety disorders. However, further research is needed to elucidate the underlying mechanisms and establish effective therapeutic strategies. Psychodynamic perspectives offer a valuable lens through which to understand the etiology and treatment of anxiety disorders. These perspectives emphasize the role of unconscious conflicts, unresolved childhood experiences, and maladaptive defense mechanisms in the development and maintenance of anxiety symptoms. Psychodynamic therapies aim to bring these unconscious processes to conscious awareness and promote insight, fostering personal growth and symptom relief. By exploring the underlying dynamics contributing to anxiety, individuals can gain a deeper understanding of their symptoms and develop healthier coping strategies. Anxiety disorders can manifest differently across different cultures, highlighting the significance of cultural considerations in diagnosis and management. Cultural factors such as societal norms, beliefs, and values can shape the expression of anxiety symptoms and influence help-seeking behaviors. An understanding of cultural nuances is essential for accurate diagnosis and the development of culturally sensitive treatment approaches. Culturally adapted interventions, incorporating cultural beliefs and practices, can enhance treatment engagement and improve outcomes for individuals with anxiety disorders. Advances in technology have introduced innovative approaches for the treatment of anxiety disorders, such as neurofeedback and brain stimulation techniques. Neurofeedback involves providing individuals with real-time feedback on their brain activity, allowing them to self-regulate neural patterns associated with anxiety. Brain stimulation techniques, including transcranial magnetic stimulation, TMS, and transcranial direct current stimulation, TDCS, target specific brain regions implicated in anxiety regulation, modulating their activity. These non-invasive interventions show promise in reducing anxiety symptoms and offer potential alternatives or adjuncts to traditional pharmacotherapy and psychotherapy. Emerging evidence indicates that the immune system plays a vital role in the pathogenesis of anxiety disorders. Dysregulation of immune processes, including increased pro-inflammatory cytokine levels and altered neuroimmune interactions, can contribute to the development and maintenance of anxiety symptoms. Targeting immune mechanisms through immunomodulatory agents or lifestyle interventions such as exercise and stress management techniques may hold promise for the treatment of anxiety disorders. However, further research is needed to fully understand the complex interplay between the immune system and anxiety and identify effective therapeutic strategies. In conclusion, the understanding of anxiety disorders has advanced significantly through neuroscientific research. Neuroimaging findings, the role of the endocannabinoid system, the impact of childhood trauma, genetics, cognitive biases, neurotransmitters, neurocognitive deficits, inflammation, psychodynamic perspectives, cultural considerations, neurofeedback, brain stimulation techniques, and immune system involvement all contribute to our comprehensive understanding of anxiety disorders. By unraveling the intricate neurobiological mechanisms underlying these disorders, we can devise personalized and effective interventions that alleviate the burden of anxiety and improve the quality of life for affected individuals.